Illinois saw another 1,100 new coronavirus cases today, along with 24 deaths. Many of those new cases are in the St. Louis region, where the positivity rate is now 10%. Chicago's positivity rate now 5.3%. That's up from 4.8% last week. Another big concern, the upcoming flu season. Joining us live now, Chicago Public Health Commissioner Dr. Allison Arwady. Dr. Arwady, thanks for your time. Let's first talk about Chicago's numbers. You've often said once Chicago hits 400 cases a day, we could see some rollbacks in what's open. Right now, we're averaging 350 plus and ticking up. At that uptick pace, when might we see the rollbacks happening, and what could that look like?
Sure. So you're right. We continue day after day, week after week, just seeing this slight increase in cases. And it's not been a dramatic rise like we were seeing back in March and April, but it has continued to rise. We've been seeing it go up about 5% a week, give or take, and that could leave us just a few weeks away if we're not able to see these numbers turn around. So we're definitely concerned, and now is the time for everybody in Chicago to be extra careful with the things that we know work to help turn this spread around.
So obviously, with that being in the future, not willing to talk about what the rollbacks would look like. Let's go on to another topic. The coronavirus shares many of the same symptoms as the flu. Flu season is around the corner. I'd imagine there's not a real playbook for a pandemic and a flu season overlapping. It sounds pretty fret-worthy. Let's talk about that, as well as a test that can potentially detect both.
Sure. So every year we have a huge healthcare surge related to influenza. And so right now is the time for people to start getting their flu vaccine. You can get it at your doctor, you can get it at a pharmacy, you can get it through the Chicago Department of Public Health. But you're right, we don't know what it will look like to have people co-infected with influenza and COVID-19. But we do know that the flu vaccine is one of the very best ways to help preserve our healthcare resources for anybody who needs it for COVID-19. So now is the time for people to start getting that flu vaccine, protect yourself, and help us protect Chicago's resources for whatever this winter holds from a COVID-19 standpoint.
And is there, briefly on the second question I asked, is there a test that can dually detect them both?
Oh, sure. Yeah, definitely. So we've had rapid flu tests available for years, and we are increasingly seeing the COVID testing being added on to some of those same platforms that we've seen for rapid flu. So there's been some new approvals for some quicker tests just in the last few days. And I think increasingly as we move into flu season, we will need to be testing people for both COVID and flu, but only one is vaccine preventable right now. So again, now's the time to get that flu vaccine. But yeah, we'll need to do testing for both.
I can hear that urgency in your voice, urging people already to get their flu vaccine. Some doctors' offices don't even have it yet. But there has to be some concern, and I can hear it in your voice, potentially about people just overwhelming doctors' offices and urgent cares, whether that's to get a shot because they're sick, they think they're sick. How's that going to be handled?
Yeah, so right now, while we remain broadly in control here with COVID, now is the time that we would like people to be going into the doctor, getting their preventive care, getting their health in as good shape as we can going into winter, getting that flu shot, because we don't know for sure what this is going to look like this winter. Certainly, we have a lot of plans and procedures in place. We've thought a lot about how to help keep our health system from getting overwhelmed. We learned a lot. We didn't get overwhelmed with that big surge in the fall, but we've learned a lot, I think, about how to make sure that resources are being distributed. And I think we're as prepared as we can be heading into the fall. But having people do these things now to help keep us from getting into trouble this winter is going to be really key.
All right. For you, Dr. Arwady, I'm pretty sure we're probably going 6 months in without a day off. We appreciate your work, and we appreciate you stopping in to join us this evening. Thank you.
Thank you very much.